Okay, so I'm Rani Polak. I'm the program director of the chef coaching program. So let's start with a little bit of preliminary data and background.
Thank you, Jane. And in the past few years, there are quite amazing papers that are coming out that show the consequences of consuming ultra-processed food. And you would imagine that the connection between ultra-processed food and health is well established because we all know that ultra-processed food is high in saturated fat, is high in I don't know high in sugar. But only in the past few years there are validated tools that help researcher. Also help my team. I mean, we are using the same tools as well to publish high quality works. So this is, for example, a very important paper that was published in in BMJ a few years ago that looked at ultra processed food consumption and mortality. You know, this is what we always look at, hope to look at. Health issue or health topic and mortality. I mean, you cannot go stronger than this. And you can see quite clear from almost 20,000 participants from Spain, aged 20 to 91, that there is a clear correlation between higher consumption of ultra-processed food and relative increase for all-cause mortality. You know, if you want to be more specific, so for each additional serving of ultra-processed food, all-cause mortality increased by 18%, which is quite dramatic. You know, the next question would be, what is the mechanism, or what are the mechanisms that cause this increase in mortality? So let's start with looking at diseases, and this is another paper that was published in BMJ. Use the same tool. Now we are looking at more than 100,000 participants, age over 18, and again, and you can see like a clear correlation between ultra processed food consumption and increased risk of cancer, mostly breast cancer. Looking at other potential mechanism, and this is again over 100,000 participants from France, and you can see a clear correlation between the proportion of ultra-processed food in the diet and cerebrovascular disease. And this study is even more interesting, because what they did in this study, they stratified to all the macronutrients that we know are high in ultra-processed food and that we know increase risk of cardiovascular disease. So they stratified to saturated fat, to sodium, to sugar intake, to dietary fibers. And after all these stratifications, they still found that there is a correlation between ultra-processed food consumption and cerebrovascular disease. So what is the mechanism, the specific mechanism? Probably multifactorial. We do not know, and I will show a few studies just now. But one solution will address all the mechanism, and this is home cooking. As much as we will empower our patients to do more home cooking, our assumption and the assumption of all the people that work in the culinary medicine space, that empowering people to do more home cooking can address all the factor and can decrease the risk of cerebrovascular disease, decrease the risk of cancer, and address early mortality. This is another interesting study, and again, if you wasn't impressed from BMJ, so now we are talking about cell metabolism, which is even higher journal, and this is just show the importance of culinary medicine these days. And this study show actually it was quite a small sample, only 20 patients, but the methodology was very interesting and very good. So they admitted 20 patients to the NIH hospital. And they split the 20 patients to two groups of 10. The first group of 10 received for 14 days ultra processed food, and the second 10 received for the same 14 days minimally processed food or home cooked food that was matched for everything, calories, sugar, fat, fiber, everything. There was one difference: ultra processed food versus minimally processed food. And after 14 days, they switch between the groups. So the group that consumed ultra processed food received minimally processed food, and vice versa. So we had 20 patients that were the control of themselves. For 14 days, they consume minimally processed food, and for 14 days, they consume ultra processed food. They could eat as much as they want, and these are the outcomes. And you can start with the bottom graph, and you can see that during the 14 days of the unprocessed food or the minimally processed food or the home cooked food, people lost 1 kilo on average. And during the ultra processed food time, people gain 1 kilo. And again, without any caloric limitation. Actually, people ate whatever they want from the food that were served to them. And I'm not sure how many of you are clinicians, but when I wear my clinician hat, it's kind of amazing. Without any effort, people can lose weight just by consuming minimally processed food or unprocessed diet. If you look at the upper graph, so you can see that during the 14 days of the minimally processed food time, they on average consume 500 calories less than during the ultra processed food. And a very important question would be why. And I know that in our future research, I will present what we do in a minute, but I know that in my future research, I would use food addiction questionnaires, because there are quite interesting studies that show that those who consume ultra processed food are going through some kind of a food addiction, and that might be the cause that they ate literally more food. And the last slide on the potential mechanism of ultra processed food. So again, this is a very interesting study that was published in Science Translational Medicine a few years ago. And what they did in this study, they looked at one food preservative. They looked at propionate, which is a food preservative that all of us consume. You can find it in pastry and in dairy products and in many food items that you consume. And they looked at the correlation between propionate consumption and insulin resistance. And they looked at the direct study. The direct study is a New England Journal study that was published about a decade ago. Back then, they looked at the differences between Mediterranean diet and low-fat diet and low-carb diet, but this is like unrelated to this work. What they did, they took all the data, regardless of the diet that people follow, and just look at the correlation between propionate consumption and insulin resistance. And they found that there is a positive correlation between propionate consumption and insulin resistance, unrelated to body fat. And this is really interesting. And when you think on when you think of, for example, the trans fat, that about maybe even over a decade ago, we understood that it is not healthier than saturated fat, and people should avoid trans fat. So in ultra processed food, there are like hundreds, if not thousands, of all kind of material and I cannot call them ingredients that we really don't know what their impact on our health, and that might be just the tip of the iceberg. So within that environment, quite obvious that the field of culinary medicine is now emerging. We don't have an agreed definition yet to culinary medicine, and this is something that we are working on in other projects that we do. But let's say people are doing more and more home cooking workshops and home cooking education programs to patients with the hope that this will improve their health. And this is the one of the definitions of culinary medicine, the practice of helping patients use nutrition and good cooking habits to restore and maintain health. This is a definition from the from the American College of Preventive Medicine website. And for those of you new to this field, so I think this is, to my opinion, the most important, the most important definition until now. And if you want the definition in a layperson language, so Michael Pollan is my hero, and a nice definition would be: eat all the junk food you want as long as you cook it yourself. And there are studies, mostly cohort studies, that looked at the correlation between home cooking and health. This is, for example, a publication from the North Health Study and the Health Professional Follow-up Study, two of the most significant nutrition studies in the past decade, over 2 million person years of follow-up. And they looked at meals prepared at home. They looked at lunches and dinners, and they found that there is a correlation between meals prepared at home and risk to develop type 2 diabetes. And actually, those who ate more meals prepared at home had lower risk of developing type 2 diabetes. And they found that this is most probably due to less weight gain. However, a number of interventions that offer to patients try to improve patient health. And in the past decade, we had two systematic reviews that looked at those interventions. And as you can see from the citation, the same author and the same journal publish these two systematic reviews, and they use the same criteria. So you can see that the field is really emerging. So you see that from 1980 to 2011, there were like 28 studies identified. So in 30 years, only 28 studies, and in 5 years, from 2011 to 2016, 24 studies were identified. But the main conclusion of the two systematic reviews that probably culinary medicine interventions improve cooking knowledge and skills and confidence, probably improve diet quality, but still they have inconsistent health outcomes. And the main conclusion of these two systematic reviews is that well-designed studies are needed that will rigorously evaluate long-term impact on cooking behaviors, dietary intake, and most important, obesity and other health outcomes. And this is where I know that there are a number of groups that in the US that try to address this need. And one of the groups is the chef coaching. And what we are working on in the past few years, in addition to educating clinicians, is evaluating the long-term impact of culinary coaching on metabolic outcome. And culinary coaching is just one method to deliver a culinary medicine program. So what is culinary coaching? Culinary coaching is an educational approach that this is like the highlight of the work of our team. This is an educational approach that we developed at Spalding. And this is a behavioral intervention that combine health coaching with culinary training. And the goal is to use this combination to empower patients to do more home cooking. And the study that we started in 2019 used a very straightforward culinary medicine approach or culinary coaching. We met patients one-on-one. And Jane, that we viewed before, was one of the providers of this study. I was one of the providers as well. And we met patients for 30 minutes television through the Zoom. Okay, 12, 30 minutes televisit. And what we did during these 30 visits was a combination of health coaching and culinary training. So each meeting started with goals review from previous meeting goals. Each meeting finished with goal setting, mostly culinary goals, of course. And during the session, we worked on all kind of culinary challenges of the participants. We help them to better organize the kitchen. We help them to find good recipes for them. And we provide patient-centered culinary tools, okay? It was a multi-center randomized controlled trial with 1 year follow-up. We recruited 72 patients to this study with overweight or obesity. We recruited patients with BMI 27.5 to 35, like midway overweight and through obesity. And our primary outcome was 5% weight loss in 6 months. Why 5%? Because 5% is the weight loss that the FDA is looking for when they approve the weight loss medication. Why 6 months? Because previous studies show that at 6 months is the deepest weight loss in many nutrition and weight loss intervention. So this was our goal. We don't have final results yet, and I will show like maybe 2 slides that I showed before for those of you who was in our meeting before, and then new data. So we are now working on the final analysis of the results. About a year ago, we did preliminary analysis, and back then we had 11 patients that reached the 6-month point from the intervention and 13 patients that reached the 6-month point from the control. And you can see that the average weight change in the intervention was 4.2% and the control was 0.8%. And even back then, the p-value was 0.008, which was back then very promising. A year ago, we had also 11 patients that reached to the 12-month point. And you can see that the average weight loss of the intervention was 4.1% and the control gain 1.2%. We didn't do statistics to this small number of participants, but we were happy to see that the weight loss was maintained up to 1 year. And I'm sure, and I have more current data, but I'm showing you this data because I have nutrition data from the same time, so you can compare the nutrition data to the weight loss data, and you can see a very dramatic change in the ultra processed food consumption. You know, the same time point, same participants. We didn't look at 12 months because 11 people is not a lot, but you can see that the intervention group consume almost half of the ultra processed food that the control group consumed, and back then it was statistically significant. What I can also want to share is a small component from this research that we already published. So I don't know if you kind of, when you looked at the timeline of our study, you matched this timeline with the timeline of the COVID-19, but we started the study around 6 months prior to the pandemic, and then the pandemic came, and it was quite challenging to continue the research. We were lucky that the culinary coaching is a telemedicine approach, so we could continue the intervention almost without any harm. but it was very difficult to invite people to our clinical research center to give blood work and to weigh themselves and to do body composition. So we had a hard time, but what we decided to do is to see whether the home cooking intervention also helped with emotional well-being and not only with weight and body composition. And there is a lot in the past few years. There are lots of reviews and few studies that show the connection between ultra-processed food consumption and emotional well-being, and home cooking and emotional well-being, but there are not a lot of interventions. So what we did, we evaluate only the participant that came to the CRC during the first wave of the pandemic from April to May 2020. So we determined that is like the most stressful time of the pandemic, and we use the brief resilient coping scale. It's a scale that evaluates all kind of coping techniques or coping strategies. For each strategy, you have 2 questions. So the 15 coping strategies sum up to 30 questions. And there is a Likert scale from haven't been doing this at all to I have been doing this a lot. And when we compare the control and the intervention, and we had only 28 participants because we evaluate only those who are scheduled to come to a visit between April and May 2020. We found that the intervention used home cooking as a coping scale more than the control. And this was the only coping strategy that we found significant difference between the intervention and the control. So we think and we will try that, and we'll try to prove that in larger study that culinary medicine intervention can also help with emotional well-being. And I think this is the slide that I'm most excited to share. And I think, Jane, this is the first time that you see this slide, and this is like the impact of the work that you did. So you should be proud of this. And so we can see that we summarize the weight change at 3 months, at 6 months, and in 12 months. And you can see that there is a significant change in the weight of the participants at 3 months, at 6 months, and the change also maintained at 12 months. So this is really exciting. I can also show that these results are not final. So this statistic is accurate. It's not. I'm not saying that the statistic is not final, but one of the challenges we had is that because of the COVID, many participants came to the clinical research center to weigh themselves and to give blood way after the time window. So where the CRC was closed for a couple of months, and then it was open, and then it was closed. So many visits were out of the windows of the protocol windows of the study. And now we are working to make adjustments and stratifications, and maybe to look at the time from the baseline rather than specifically the visit. So there is more to come, and we will do more mathematical manipulation to these numbers. And before I finish and open up to questions, so I would like to share what we are share more stuff that we are working on. So as I shared, culinary medicine has yet to be defined, and a few months ago we were awarded a grant from Harvard Radcliffe Institution to run a summit to define culinary medicine, and we are now working to define a group of experts that will come to Boston in January 2025, and we will start a Delphi process to define the field of culinary medicine, to define learning objectives, and to define hopefully curricular outlines. We are also working with Queen's University in Ontario, Canada, to evaluate the feasibility of culinary coaching with patients with spinal cord injury. You know that nutrition impact like several health conditions, not only obesity and not only diabetes and not only cardiovascular disease, and there are many patients with disabilities that truly needs this help. And we are also running a randomized controlled trial to evaluate the impact of chef coaching training, the medical education training that we are offering on medical students' competencies to prescribe nutrition. We are doing that in collaboration with a medical school in Canada, and we also run a randomized controlled trial to evaluate the impact of home cooking on telomere shortening, which is one of the molecules that's probably related to longevity. And maybe before I close up, I would like to share that as much as the research in culinary medicine emerging, there are more and more journals that are interested in culinary medicine, and Nutrients just published a whole volume on culinary medicine a few months ago. And now Frontier in Nutrition, which is also a very good journal, decided to to designate a volume to culinary medicine, and I was honored to be invited to be one of the guest editor. So if you do work in culinary medicine, and if you're looking for a home to publish your work, so please consider this option. This is great that more and more journals are offering culinary medicine opportunities for publication. And before I finish, like 2 words on the program that we on the medical education program that we offer. So we offer a medical education program that literally teach what we know and what we evaluate, and those who complete the program knows how to deliver the culinary coaching program, which we now know that is effective. It has two components: chef coaching the basics and chef coaching beyond the basics. This is the certificate that graduates receive when they complete the program. And we have 2 upcoming events. For those of you who are interested, we are offering this program through Harvard Medical School. So, and the advantage of taking this program through Harvard Medical School is the CME. Another advantage that there is an opportunity for a self-paced engineering material option at a reduced cost, and you can do that in your own time. So the upcoming event, we have chef coaching the basics. So the engineering material you can take whenever you want. The live event is like in 2 weeks, in June 6, 2024. We already have over hundreds enrollments, so we don't have lots of rooms in this cohort. And you can continue to chef coaching beyond the basics in July 2024, and there will be more options to take chef coaching beyond the basics in 2025. And we also offer chef coaching the basics through Spalding. The advantage of taking the program through Spalding, the advantages, I would say, it's a combined program. You take chef coaching the basics together with chef coaching beyond the basic, which I think is the best way to learn culinary coaching. And we have exciting credits through the National Board of Health and Wellness Coaching and the American Chef Federation, and also the Academy of Nutrition and Dietetics. And the next cohort is in September 2024, in few months. This is the great team that do the work that I presented. There are several ways to follow up and to learn more about what we do. You can join our mailing list and receive email with recipes and tips and news about upcoming events. Jane is the editor of this newsletter, and you can also follow us on whatever social platform that you like: Facebook, Twitter, Instagram, YouTube. And I see that there are tons of questions. So thank you so much for joining. I hope I made it on time for your lunch break.